I didn't know what anti-aging medicine meant. He said, there are all these ways that the body can decline with age, but if you address all those causes, then you're preventing the decline, so you're preventing the aging. That's anti-aging. I was like, wow, that's amazing. So and then he told me he was doing stem cell therapy. And my first question was, you can do that? I thought they're still doing research on it, because that's all I was taught. There was no reason. If I was in psychiatry and addiction medicine, there's no reason for me to know that stem cell therapy has progressed.
Welcome, everyone, to another episode of Wellness at the Speed of Light. I am so excited to have Dr. Joy Kong on the show. I follow her religiously on social media. She has an amazing podcast in her name, the Joy Kong Podcast. Phenomenal stuff. And she is otherwise known as the Stem Cell Queen. And it is for real. I mean, some of the stuff you talk about, you break down these concepts in a way that just lay people can understand. And you also help to dispel some of the myths that are out here in the worlds of regenerative medicine and stem cells. And I cannot believe how much misinformation there is out here. And people are just out here saying the most random stuff. And a lot of them are our colleagues, unfortunately. So on that note, welcome to the show. And I'm excited to dive right in.
Oh, thank you, Dr. Sinicropi. So good to be here. I love your spirit, love all that you've done. So I'm excited to do some deep diving.
Yeah, let's go right in. So first of all, tell me a little bit about how you ended up here in the United States.
When I was 15, well, that was in the 80s when China just opened up to the world, and I was so excited about what America represented, which was freedom, right? Freedom
Absolutely.
For speech and for personal accomplishments and abundance. And I thought this is incredible. It's very exciting to think of people of all colors and all background can all come to one country and somehow live peacefully together for an ideal of this freedom. Yeah, so I wanted to come to the US, but my very first attempt when I was age 20, of trying to come to America was that dream was kind of shut down with my visa rejection. So I wrote about it in my book Tiger of Beijing. Yes. That's where the first chapter was about. It was my visa rejection. So I had to find my way here, which my friends all said was next to impossible, and I decided to challenge the impossible. And I talk about it as like a poking in the universe. Like if you have a thought, you have a goal. And if you want it bad enough, the universe will come to help you. But you still have to do something, right? You don't just sit on your ass and thinking the universe just do everything for you. So I did some poking. So I talked about in the book, I did something to create the impetus so the universe can come and help me. And 8 months later, I made my way into San Francisco. So I arrived and saw Golden Gate Bridge on the first day, and it was, pretty incredible.
No, it's amazing. I think the story of America, is incredible. I love the way you say it. It is an ideal. It's a dream. It's just a different standard. And I hope that we can continue, carrying that forward, regardless of politics. I'm apolitical. I take care of everybody. That spirit is what makes us great.
Yeah. And I think it's true. America does give a lot of people opportunities. And the reason I can be what I am today, I have to credit a lot to the system. The fact that there's safety net. I talked about how I ran into very difficult challenges. I ended up having to escape from a situation. But America as a society is charitable, and it has this spirit of helping people who don't have resources. So because of that safety net, I was able to be helped and actually to survive. And then it also has this, spirit of helping, also nourishing talents and giving them resources, because I was penniless. I had nothing.
Amazing.
But I got scholarships because it wanted to reward talents. And that really helped me through. So each way each step of the way, the system, American system, actually was working.
Well, it was a combination of the system and also your sheer hard work, will, and calling on the universe. And it honestly, it's a theme in my life that people that I talk to, that I'm attracted to come into my life, to come on the podcast, or people that I go to these events with and things like that. A lot of them always talk about that particular thing, about having the universe align with you, because it wants to, it wants to help you, but you have to be there, and you also have to recognize that there's this source that we can pull from. It's infinite, and it's really amazing. And the study of it, like through quantum and all these other things, energy healing, it's just amazing. I'm fascinated, by that stuff. So anyway, let's fast forward. It's crazy. I mean, you're board certified in like different stuff, like right, psychiatry, neurology and addiction medicine, right?
Right. And but very quickly, when I was studying for addiction board certification, I met this doctor who was an anesthesiologist, who's also trying to get board certified. And I asked him, what do you do? He said, well, I'm an anti-aging doctor. And that was 10 years ago. And what I said was, what is anti-aging medicine? I never heard of it, right? Most doctors are sitting in their little silo that's built for them, and they have no idea how medicine is progressing, really the new way of doing medicine. So I didn't know what anti-aging medicine meant. He said, there are all these ways that the body can decline with age, but if you address all those causes, then you're preventing the decline, so you're preventing the aging. That's anti-aging. I was like, wow, that's amazing. So and then he told me he was doing stem cell therapy. And my first question was, you can do that? I thought they're still doing research on it, because that's all I was taught. There was no reason. If I was in psychiatry and addiction medicine, there's no reason for me to know that stem cell therapy has progressed to the point where people were using it. I was right there with
you, completely lost in my understanding.
You're horse blinders on.
Completely, yeah. We're doctors. They put blinders on us for a reason. You will conform, and you will do it this way.
Yeah.
That's
really,
just the
it
way
felt
it
like a bit of brainwashing, going to UCLA. And I know people who are very open to different forms of medicine.
Right.
And then they go to medical school. All of a sudden, everything else that they used to believe in, used to respect, somehow became heresies for them.
They put the blind. I'm telling you, they put you. It's on purpose. Right?
Yeah,
it's
I
very
know.
pharma.
I remember how hard we were laughing at homeopathy. And then I went to India, following this homeopathy doctor, and he was telling me all these incredible cases, case after case after case. So at some point, you just have to say, whoa, something is here, right? I can't just, based on my philosophy, reject fact.
Yes.
Yeah, if you're a true scientist, you don't reject fact. You find out why.
Well, you find, but like before we go further, I just want to say, in a lot of, when we talk about like peptides and stem cells and things you love talking about, and I love talking about, this is what we talk about. Once you get into the anti-aging thing, it's like an addiction, right? One, personally, but also to help people, right? But this kind of idea that we're not allowed to do these things, or something's like, wrong with it, or you're made to feel bad as a doctor when you're talking about some of these things, even when you see it, like you said, with your own eyes. That's the thing. You still feel bad. Like at the beginning, you're like, I know that I'm seeing these great results, or I followed a homeopathy doctor, or whatever it is, or I hear these people are taking this peptide and it's amazing for them, but you don't want to say anything because you feel like you're going to say like a bad word or something like that, But the truth is, and this is what I said this, when I put things out, and let's say I talk about a specific peptide or something, something like right away, where are the randomized controlled, studies of 10 million people? For number one, people have no idea what it takes financially to study these things. It's wild. To get something FDA approved as far as like a peptide, it's a tremendous amount of money. It's huge, right? You need major institutions, you need this and that. But the point being, let's just say for any therapy, let's say a homeopathy, you have a supplement. If you see 3 people in a row that you put on it, they're doing good, maybe it's a coincidence, maybe it's, whatever. if you, over your career, you start seeing stuff and you see 50 people that have gotten tremendous results from it.
Yeah.
Let's just move away from stuff. And it's completely safe. There's no adverse events or anything. Why? I don't need, that's the beauty. We don't need studies. Like it's obvious. We want studies, but I don't have $50 million to do the study.
Right.
So I'm going to use it if it has a good safety profile. And if I see patient after patient having an amazing, result.
Yeah.
And we understand systems biology. We know pharmacology. We know there are other, stuff. But yet the criticism, it comes. They're like, I can't believe that you're prescribing peptides.
And they forgot that's how medicine was developed in the first place. One brave
Thank you.
doctor, right?
Thank you.
Brave doctor put something in his own body and realized, oh my God, this is incredible. What just happened? And then tried it on a few people. And now all of a sudden we have a new therapy that got born. And then thousands got saved, right? So
that is exactly right. That's how this is the scientific method. Literally.
Right.
And people have to realize if you do a randomized controlled study, there's still people getting it. They're still getting it. It's just a different, group of people. It just doesn't make sense. It's a pet peeve, but I digress.
If you want
going.
to wait for the randomized control trials to finish in 20 years, you go ahead, you can wait. Or you can respect that biology happens a certain way and we understand certain therapies, right? Peptides, how they work, we have some understanding, we have some evidence, or stem cells, there's some evidence. So you can utilize some basic knowledge and common sense and make an educated decision whether or not you want to utilize this. Unless you want yourself to keep declining and not getting help and then wait until the FDA says it's okay. I mean, that's your choice, but that's a missed opportunity.
But here's the deal. Doctors themselves, the ones that are in the anti-aging space, the ones that are open-minded, they're all doing this stuff. They're doing it themselves, right? The ones that like once we do the research and then we do it ourselves. And there's thousands of doctors that are doing it to themselves and they're fine. Why? Because they know the side effect profile is very, it's very safe, these things, and they know like the general, ramifications of it. It's not like the people that are doing like stem cells are not doing themselves. I don't know any stem cell doctor that doesn't do stem cells to themselves, right? All of them do.
Yeah.
So this is what is so dangerous. It's so dangerous that the doctors themselves, who have all this education, are doing it themselves. Yeah. Oh my God. Imagine if they're giving it to people. They're horrible human beings. It's the most, I honestly, our colleagues need to just wake up. And the other thing I say to my colleagues, and you're absolutely right. You want to age faster? Don't do anything. You do your thing. Yeah. I'll do my thing.
Right.
I'll see you in 20 years. Bye-bye.
I always say human society is going to start to have different types of people, right? We can have a class reunion. Everyone's 65 years old. So there will be a group of them that look like they're 65 or 70, but there's another group that will look like they're 45.
Of course.
So depending on what you want to do with your life. So we're heading in that direction. But coming back to, the systemic kind of suppression of the new evidence of medicine, that is perfectly illustrated when doctors help a patient. The patient is doing better. The doctor can't even show what the patient has, how the patient responded, because the moment you put this testimonial on social media or the internet, then it's considered making claims. So here we're just showing facts, right? What happened to this patient? And that's how medicine has been developing, is by case by case. We want to share what is the new evidence, what's going on,
100%.
What can something do? So to suppress that, saying that just because you are allowing this patient to speak of their experience, now you're making a claim. And that's complete monopoly on the way medicine's practiced.
Well,
because you have to use drugs. Why are you able to use drugs? Because drugs has FDA approval. So because
you mean the same FDA that has 49% of its funding from big pharma. That FDA, is it the same FDA? I'm just checking. Let me just make sure we're in the same boat. Mm-hmm. Really, there's some interesting stuff. And you're absolutely right. Continue on the suppression piece. I like it. Keep going. Keep going.
It's really sad that, how is that making claim? When can doctors not speak of their experience? So where's the freedom of speech? Why can't I express what I've discovered in the world? Like, why is that not okay?
But yet, now we got to step in. Now we're going to step in deep. But yet, it's interesting because they'll say that with a doctor posting something, but yet you'll have influencers out here, literally, and all day. It's my whole feed, right? Because I talk about peptides a lot, so I have all these like influencers on my feed. I didn't ask for them. I don't follow them. They're just on my feed, right? They have the needle in their hand. They're like shooting stuff. They're showing people how to inject. They're telling them what doses to use. They're whatever, and it's the gym bro. Which I love those people. I love going to the gym. I go to the gym all the time. I hang out with the gym bros, but I'm not going to get my medical advice. And here's my thing, and I don't know what your take is. I love influencers. I'm glad they're putting certain things on the map because people are using these things. The problem is that they don't have, there's no ramification. The influencer, they don't have a board. Oh, we're going to call you to the board now. Oh, no one. It literally can go on there and tell, you can, if you are just you can literally go on there and say, oh, mix this peptide with Prozac, with cocaine, with whatever. It's great. You have the best night ever. Zero ramification. Literally zero.
Wow.
We say something, board. Here's your board letter. But we're experts. We've trained for we'll practice for. I've practiced for
completely
decades.
Backward.
It's the dumbest system. It's hard to explain. I cannot. So before we get too upset on that, the other thing that really bothers me, and you talk about evidence, all right? So when it comes to things that are in the more holistic world, and this could be as simple as a supplement, like for example, like natty kinase on breaking up like plaques and things like that, to stem cells, to peptides, to different types of photobiomodulation, light therapies, oxygen. It's crazy because there's so much pushback from our own colleagues sometimes. Like you'll post stuff, you'll say, oh, we treated like MS with this thing or whatever, with light therapy and oxygen and whatever in conjunction with their, their normal, immune suppressants, whatever. And they did really, really well. Even when those doctors, they're so brainwashed, even when they see the results, they're like, oh, that did nothing. That's not why. And people are like, well, it's interesting because I've been sick for 7 years. I started this 3 months ago and I'm 90% better. They're like, well, it just happened. The disease just burnt itself out. They can't even believe, like do you see that? It's bizarre. I've never seen anything. I've never seen anything like that. Mm-hmm. It's like everyone that goes to to crypto.com arena across the street, you walk in there, 10 people walk in there and they come out 10 years younger. And then we document it, we show the pictures and people are like, no, that does nothing. It does nothing going in there. I'm like, that's weird because they're a decade younger, but it does nothing. That's the mentality right now. It's completely broken. And
but what's interesting, one ray of hope is that people are
Give me a ray of hope.
People are not that dumb. This is why you're doing the biohacking. That's why I just attended biohacking. Yeah. And there are lots of people who are really excited to start incorporating these new technologies. So it's because people want health. They want to be vibrant. And that human desire to be well and to live to their potential is so strong that even big pharma cannot suppress it. It's coming through. It's this grassroots movement that no matter what you do, people want to get better, period. And they found something that got them better, you can't suppress it.
You're absolutely right. It is breaking through. This is the best time ever because people now, this is my concern, like whatever, this is an aside, but my concern is that because there are so many doctors out here, instead of just saying, you know what, I'm not really comfortable with that, let other people do it and just say, yeah, there's a lot of potential for peptides and stem cells. I just don't want to go that direction. They come out like so strongly against the stuff, and half the time they're literally making stuff up. They don't even know what sometimes they don't know what they're talking about. Yeah, there are a lot of peptides that don't have randomized controlled, studies, but anecdotally they have great evidence. And you know how I know that? Because I talk to a lot of stem cell doctors and a lot of peptide, and they're all seeing the same stuff.
And what's really funny is
crazy.
A lot of these doctors, when they start to encounter health problems and they tried everything,
then they come to us.
And then something miraculous happens with whatever they're doing, either supplements.
Then they become longevity doctors.
Yeah, all of a sudden they become fanatics.
Well, absolutely. It's painful. It is a huge. It's like they don't. But what I was going to say is, then the problem is that the lay people, if you look at comments in a lot of these, like when I post now, a lot of comments are like, I've lost complete trust in doctors and the medical system, which is bad, because then you know what happens? Then people don't go get their preventative care. They don't get their colonoscopies. They don't get their breast exam. They like, the medical system is trying to kill us all. I am worried that doctors are pissing people off so much that it's bad enough that the visits are 7 and 8 minutes long, and going to a doctor telling them I'm fatigued, I don't feel good, is a complete waste of your time. You're better off ChatGPTing it than going to the doctor for that.
The thing is, I think the conventional medical model is a dying breed, but it doesn't know it. So the doctors who are trapped in the system, they have no idea that they're becoming quickly irrelevant, and they still think that they're practicing the gold standard medicine when they're just left behind. The whole new way of doing medicine is taking off, and there are all these people who are following. Then they're just dumping the conventional system. So the doctors, pretty soon, they're going to realize that they're not going to have many patients, that they have to learn how to do this new way of medicine. That's what's going to happen in 20, 30 years.
It's interesting. I have a partner at my spine clinic. He's a neurosurgeon. And I actually just had this conversation with him about 4 weeks ago. He sat across from me, and I was like, what made you so interested in our integrative health clinic, now, because we've been going for a while? And he's like, he said he was in Tulum in Mexico, and apparently it was a great time, but he just said he had an epiphany there. He's like, this is the way. He's like, what you were doing, in that space, that integrative health space, he's like, this is the way. He's like, if I don't start doing this stuff, he's like, I'm not going to have anything else to do. There's plenty of people that need brain surgery,
right?
Or spine surgery, but as far as the other stuff, he's like, they're not going to come to us for anything, and I want to get involved. And this is a neurosurgeon talking. So this is my second, neurosurgeon colleague that has had this epiphany. That what we're doing is, is game change. So he's all into stem cells now and peptides and all this other stuff. But one other thing I was going to say, you talk about like a dying breed. So I want to, no, it's true.
But
I'm going to go on. I want to talk about neurology for a second. This is important because you're boarded in neurology. The way that concussion is treated is, and again, I say this freely, I say it openly, how we're treating concussion for the most part is a complete and utter joke. It's a joke. It makes no sense. And so there are like the new way, in addition to like, like you do some peptides and stem cells and stuff like that, but like, for example, like using transcranial laser therapy for concussion, I've never seen anything like it. We started getting all these concussion patients coming in. I didn't know what to do with them. So we were doing like red light therapy. We're doing some other stuff. But when we brought in the laser to do the transcranial light therapy and then combined it with oxygen and then some regenerative peptides and other things, and now we've added even doing like ozone therapy with them just to detox them, just to get them really clean, get their vitamin D levels up, get their creatine, get their NAD levels, all this stuff. Amazing. The results, it's ridiculous.
Yeah, we use laser at our clinic, and I've seen laser waking people up from coma, right? Getting them to function
it's
better
amazing.
than before their injury. So
it's amazing, and you can't, and sometimes you can't even talk like this. But I've made multiple, people aren't as interested. Like those don't like the virality of like the concussion posts aren't as much because most people like that doesn't resonate. I mean, you do peptides and stem cells, everyone loves it. Concussion's not as much, but it's so important for people to understand that if they have a head injury, 90% of my patients have already treated with their concussion somewhere else. And then they come and then we do this thing. And first of all, when I give them, when we have our first hour visit together and we go through all the stuff we're going to do for them concussion, they've never heard of 95% of this stuff. They're like, I've never heard of that. I don't know what is that? What is this? How come no one told me about this? Whatever. And they're doing really well, but that's what I'm talking about. Like eventually that is going to be the way that concussion is treated for everybody. Exactly. So if people are not treating it, good. Actually, I just had one of the top neurologists in the state come the other day, and he was, his only concern was, he's like, well, are you worried about lawsuits? I was like, from putting a light on somebody's head? I'm like, with the stuff that we do, my worry on the law, it's literally, my worry is zero. It's zero. Because it's not the safety profile is so amazing with these technologies. I'm like, no.
Even for stem cells.
The safety profile is insane.
If I always say, if stem cells have even 1% of the potential problems of any FDA-approved drug, it's going to be pulled off. It's not going to be allowed.
Oh, absolutely.
It's so extraordinarily safe.
It's so safe.
But still, some doctors, because I train a lot of doctors in an academy, so I see all kinds of doctors. There are some, it has to take a doctor with some kind of guiding integrity and a little bit of courage to be able to just go into this field to provide stem cell therapy. Because some doctors I've met, the first thing they ask is FDA approved? And then the second thing they want to ask is can my insurance cover it, malpractice insurance? So those are their principles in how they conduct medicine.
Yeah, because we treat through the insurance, and we don't.
They're so concerned about their own protection. Their first question should be, does this work? Can this really help people? The second question should be, is this safe for people?
100%.
So,
and the answer to both of them is a very, very much so. I've seen it. I tell you, it's funny. We were talking about that before, and I call it, like in my upcoming book, it basically, I talk about my ignorant phase, and it's before I had an epiphany as a doctor that I didn't know anything. At some point, I realized I literally know shit. I can say that on this is my business, whatever, whatever. I did nothing. Like we know such a tiny fraction. We come out, I trained, you went to UCLA, right? I trained at Columbia. You go to these amazing institutions, these amazing people. So you think you know everything. Like how many doctors, the doctors think they know everything. They think they know like horticulture and all that. I'm like, you don't even know, you don't know anything. One thing doesn't translate into another. Like you actually have to know it. But yeah, my ignorant phase, I didn't know. Like I literally, I wasn't aware. I can't even tell you how many people I told not to do stem cell therapy. I'm like, oh my God, you're going to do stem cell? Oh, I did. I was like, oh my God. Stem cell therapy. Now it's literally my first line for everything. Yes. I'm like, you want to have back surgery? What are you talking about? You need to do you should do stem cells. It's amazing. And people are like, what are you talking about?
Yeah. And even if they have to do surgery, sometimes surgery is unavoidable.
Sometimes, there's plenty of people
stem cells right before your surgery, you're going to heal 2 to 3 times as fast and more completely.
Stem cells, light therapy, detox them, do all these things. It's so dramatic.
We're so lucky that we have these tools. People don't realize. You should be so grateful that we actually have them.
No, it's amazing to see. I have patients, like is it more of a spine thing? You have like for example, they'll have a spondylolisthesis, terrible stenosis, terrible. And they are surgical. Yeah, there's no one's going to criticize me for doing surgery on them. They're surgical candidates. They would do fine with surgery. But it is an operation and there's risks. And the patient might be like 78 years old. So it's like, well, if you don't have to have surgery, don't have surgery. A lot of people walking around with spondies with bad stenosis, they're not even symptomatic, right? And so we've taken a lot of those patients and done just autologous stem cell therapies, nothing fancy, just like either BMAC or MFAT or something like that. On some of the results it's mind blowing. They're fine. They're fine. They're literally their pain's better. It was same thing with joints, same thing with other stuff. I didn't know any of this stuff. And I always say this, I've said this many times. If I could go back, I feel like I could have saved a lot of people from having, a lot of things. Because I literally was like, I was the classic doctor. I'm like, you're going where? You're going to Panama to get what? What are you? Who's selling? You're going to spend how much money? Like whatever. Meanwhile, I'm going to go to Panama and do my stem cells with Neil, just because he's a cool guy. Actually, I did his podcast right here in his studio. Neil Riordan. He's fantastic.
Yes,
so
I met him.
Great guy. But anyway, I digress. But the truth is, we're all like that because we have the blinders on. I had the blinders on, but it didn't take me too long into practice to realize whatever we're doing, it's not working because it's not normal. Like our medical system, $4.9 trillion, but yet when you go to any parking lot of a medical clinic, it's jammed. With all these sick people. There's sick people everywhere.
Yeah.
So clearly we're doing something wrong. And they're all these sick people. They're doctor. They go to the doctor. They go to the doctor. Some of these elderly people, they live in the doctor. Right? They have. They're like, oh, you're my fourth appointment. They get the lipstick.
That became
a
part of their lifestyle, which is
they go to the
take
doctor.
all their bag of medications and go see the doctor. And it's like, is this? Does that look like a picture of health to you? Is that health, or are you just allowed to hang on to life? Like that's not real healing, right? In my clinic, I can give people treatments, and all of a sudden they start to drop medications. They get less and less medication until they're free from medication.
That is the
and then they're doing
100%
well.
goal.
That's called restoration, right? You're restoring the true vitality. You're not piling on medications and have people suffering from all these side effects, and they still have other conditions. You just barely, they barely are hanging on to life.
Well,
and
it's symptom management. It's this and that. I don't even like to use the word root cause anymore because when people say root cause, they're like, oh, here's another root cause guy. And then there's those other doctors, then they make fun of us for saying the word root cause. They're like, really? You go for the root cause? Oh, I didn't know that. I'm like, how about less sarcasm and why don't you just do some reading? Less sarcasm, more.
There's a lot of sarcasm going on. That's a great defense mechanism when you don't know.
I'm saying, listen, you're treating so many people successfully, but yet I'm sure that you get comments in your thing that are super sarcastic about the stuff you're doing. It doesn't even that makes no sense. Here's a doctor saying that she's doing treatments on people, they're getting a lot better, and you're being sarcastic. There's nothing funny about it. It's not funny. There's nothing to be sarcastic about.
You should be curious.
You should be calling, saying, "Hey, you teach doctors how to do this? I'm going to call the institute." That's what what changed my life. Mm-hmm. You could tell me literally anything. You could say, we take oil from your car and pour it over your head, and we've healed. If you tell me that and you've healed 50 people, I'm going to come and do a little bit of investigation myself. I might bring in a lab, some scientists, whatever. I'm not going to say, oh my God, this lady's, no, here we go again with these people, right? I'm just saying, look, think for yourself, have an open mind. People, if you take that, right, you're from China, think about Chinese medicine. It's been around for 5,000 plus years, right? We always say 5,000 years, probably a lot longer than that. But I'm just saying, like, people stayed healthy for a long time. I don't think they had a lot of pharmaceuticals. Yes, I get it. Infectious disease, we didn't have much. I mean, we probably had a little bit with homeopathy, but not much. Mm-hmm. So now, we've eradicated a lot of infectious diseases and stuff like that. But true health, with the garbage we're putting in our microplastics, our food is a disaster. All the the cell towers. I can go on and on. And we're very sick. We need longevity.
We have our work cut out for us because people are just being poisoned. So we have to somehow save them from
including
that.
the doctors. They're being poisoned with whatever information they feel like.
I really feel, okay, you can correct me if I'm being biased, but if you're a doctor trying to help people to be well, shouldn't you look like you are well? Because you should heal thyself first, right? You should be able
we're talking. Now we're going to go into my favorite topic.
I might be judgmental.
You're not being judgmental.
Okay.
You're not.
Yeah. It was like, why aren't you taking care of yourself?
Like, I could have like a horrible flu and I could still, treat a patient. Mm-hmm. Doesn't mean I can't treat a patient. However, how are you going to go to somebody, say, I don't feel well, and the person's clearly not taking care of themselves, is completely, unhealthy, clearly is not dialed in, can't focus. It just looks, we know what unhealthy people, we don't have to go into all that. But it's you want people that are going to walk the walk. That's why I always post like things of like me working out or doing biohacking. I'm a I'm a crazy biohacking person.
I can tell that you're a biohacker.
But I do I like do a lot of biohacking.
Yeah.
But I go on but this is like now this stuff really pisses me off. I'm in the doctor's lounge, right? So first of all, everybody, when people see me, they kind of scatter in the dark because they're like, "Oh, here we go with this guy." Because it's a lecture is coming, but it's nice. I'm just having a conversation, but I'm not lecturing. I'm just going to tell them something, right? But I'll go and I'll sit down with people, and genuinely people I like and I've known for a long time, and I say, "Hey, what's going on with you?" And they're like, "Oh yeah, I was hospitalized. I had this thing and whatever, and I had this other thing." So I was like, "Hey, why don't you come to the clinic? We can do X, Y, and Z. We can do, there's no evidence for that. I'm not gonna. And then I'm like, well, we can do this and whatever. Well, no, I'm good. I looked it up. There's no randomized controlled style. And I'm just like, and again, now I'm going to be like really whatever, like just kind of in the same thing. And this is not vanity. It's not anything. I'm like, you might want to say, this doctor that's talking to me right now is 10 years older than me, but is in better shape, is dialed in, is doing a million projects, has energy all the time. Sometimes is doing 11 surgeries in one day.
Wow.
And I can hardly stand and walk because I'm in so much pain. I'm sick. I was just in the hospital. You might want to say, maybe I should ask him what he's doing. But they're the opposite. They're in complete and total denial that, oh, it's your genetic. You look the way it's your genetics. It's your this, because that's easier for them.
Yes.
It's not because they're not doing the work. It's not because they're not exploring. It's because it's your genetics. So if you just tell, it's a complete pass. It's a complete cop-out. So yes, this is a conversation I'm very comfortable having it because it's just truth. No one's making fun of anybody. No one's saying anything.
Yeah.
In fact, it's the opposite.
Yeah.
We're trying to help you. We have tools for people, but they don't want to do it.
And to me, taking care of our body is always a sign of respect. It's like you don't take this body for granted, right? This is a gift.
Yes.
You're walking around with this gift that's endowed to you. Are you going to be a good stewardess for it? Do you,
yes.
How are you taking care of it? So I think that shows your mentality of how you are respecting, biology. And, if you are helping others, at least you can show the respect that you can help your own biology.
You absolutely have to respect yourself. The last chapter in my book is it talks about something. It's the me and you zone. So it's just the play off the blue zones. It's the me and you zones, and it's like the most serious thing I have in the chapter. And it might seem corny to people and whatever. I don't care. I'm going to say the me and you zones means. It's like I have to help me so I can help you. And unfortunately, a lot of our colleagues are not they're not even helping themselves in any aspect, which is why we were talking about like this mastermind that we're launching nationally. They're not helping themselves. And one of those categories is health. It's like, if you don't feel well, right? If I felt terrible right now, I couldn't have this great conversation with you, right? We're having an intense conversation. We're deeply. If all I would be thinking is, oh my God, I'm tired. What am I to do? Like I don't. And people live their whole lives like that. They feel like crap all day, and they're not realize you have to take care of yourself. You're going to be a better father, a better husband, a better better doctor, a better you, just a better everything. It's better when you take care of yourself, so that you can take care of the other, and then it spreads. All right. So let's just say in this room, we were all sick. Like we all don't feel good, right? So we're all crappy to each other. Go screw yourself. We're all just, whatever, giving each other the finger. But then all of a sudden I start taking care of myself. So now I'm happy and joyous. So I say, hey, Joy, you should really, and now you start doing it, and then it just starts spreading. Imagine I think a lot of like criminal behavior, a lot of like stuff, obviously relationship breakups, all these things happen because people don't feel well. When you don't feel good, it screws you up. It screws up your
Right.
life. So for the love
And
of
your brain
God,
probably is inflamed, and you can't even.
Oh, neuroinflammation. That's a whole podcast in and of
you
itself.
can't think
That's like
straight.
one of
You
my.
start using substances to make yourself feel better, and
Absolutely.
You're mean to people who love you.
You're absolutely you're mean. You're not dialed in. You can't have conversation. You cannot be present if you don't feel well. So how are you going to take care of people? So we can go down that rabbit hole for hours, but I don't want to run out of time without actually talking about like stem cells themselves. So I'm going to ask the most basic question, and I just do the. So can you? Okay, people always get this misconception It's embryonic. It's coming from this stuff. First of all, we don't use embryonic stem cells because they form teratomas. So we don't do that, right? It's just going to form a tumor.
And there are countries that have clinics that do that.
But we don't do that.
It's not legal in the U.S.
But it's also just not even like
risky.
if you look at it's risky because you can. I mean, they're pluripotent. That's not really what you want. So can you explain the difference between that and a mesenchymal day zero stem cell that like a placental cell?
So you can get stem cells from multiple sources, right? And there are all kinds of stem cells. So people don't realize that there are like 1,000 different shades of gray when it comes to stem cells. So mesenchymal stem cells is a particular type of cell that we use a lot, and it's all over our body. Anywhere you have blood vessels, you have these cells. So you can get these cells either from a person's own, like you have done that before, or you can get it from really young sources, like the umbilical cord or placenta, which is a very ethical source of young cells, right? You're not harming anybody.
Supported by the Vatican.
We are not using aborted babies. Let's just get that straight. No one is using aborted babies.
The Vatican supports the use of those.
Oh,
literally. Like it's it's a supported thing. The Catholic Church supports the use of those types of stem cells.
Oh, you mean the umbilical cord?
Yeah, umbilical cord, not embryo. Not aborted fetuses. No.
Right. So I don't know. So people are still making those comments, asking me on social media, "Oh, are you killing babies?" No, nobody's killing babies. Actually, we're really happy. The baby's born. Parents are happy. The baby's crying. We'll cut the cord. Right. Usually we throw away the cord and the placenta into the trash.
Beautiful cells in there.
But now we can extract the cells. So these are actually not day zero, even though it's collected on the baby's day zero. But embryologically speaking, they're way younger than the baby. So there are all these surface markers that baby stem cells don't have anymore are still present from the cells of the umbilical cord. So you're actually getting cells that's in between embryonic stem cells and the baby stem cells. So you're getting the best of both worlds because they're really potent. They have wide differentiation potential, but then they don't have the ability to form teratoma.
Exactly.
So it's and then they're fully ethical, right? You're not harming anything, any living being. So it's absolutely amazing that nowadays we have this tool. And back when I got into stem cell field about 10 years ago, 80% of stem cell therapy was conducted using a person's own stem cells. So that's usually fat and bone marrow. Only 20% or from the birth source, amniotic fluid and umbilical cord. And I just knew at the time, I remember teaching some doctors, I said, this is going to flip. And exactly that's what has happened. That the percentage of, I think now is probably about 50-50, but it's the majority is going to be the younger source.
I think the only thing that's holding it back from being, almost 100% is because then you don't even have to you don't have to harvest or do all those things. I think the only thing holding it back is the antiquated, laws and the pushback, and people are, worried about stuff. It's completely, it's 1,000% ethical, 1,000%. There's not even the tiniest bit of unethical, nonsense. I think the advantage to those young cells, I think for a lot of musculoskeletal stuff, I think it boils down to where you put them. So I think adult cells do really well. We get really great results with like the intraosseous, like I was talking about, and this and that. But I think where it makes a massive difference is in chronic disease. Having those cells, because they share information among each other, right? When you inject those cells IV, your own stem cells become younger. And people don't, because they transfer information. They start acting like younger cells, your own that are sitting there. So I think it's
because of the younger cells.
Yeah, because of the communication between the two of them.
Right.
They literally share information. That's how our whole body works.
Yeah, one way they share information is through microRNA. That's sent out in exosomes that the cells secrete.
It's beautiful. It's a beautiful process. And it actually
goes into the nucleus of your own cells and make genetic modifications. So program your cells to become younger.
It literally makes you. It literally makes you younger.
Which is really, really amazing. But it also donates mitochondria, which have gone through the reset process. So fresh, new, vibrant mitochondria.
Yes.
All of a sudden, you're getting this elevated energy of all your cells.
By the way, my favorite word, mitochondria.
Really?
I use it. My wife, we have a limitation at the house. 5 times a day, I can say mitochondria. That's it. I'm not allowed to go past five
funny.
times. The mitochondria is it's you know what? It's the whole enchilada, as they say. The mitochondria is everything. The mitochondria is literally the root of now I'll say root cause. Mitochondria, root cause. Every disease, look it up. I have textbooks, they're this big. It's just mitochondrial disease, everything.
Okay.
Everything, right? When your mind,
Yeah.
you could see I'm fired up about mitochondria. Keep going. I digress.
And we know one way the laser light works is by activating the mitochondria enzymes.
Complex 4 in the mitochondria.
Yeah, and
cytochrome deoxidase.
different complexes. So depending on the wavelengths of the different lights, and it's powerful. And methylene blue, we were talking about methylene blue, one of my favorites.
It's all the electron transport chain. So it's interesting because like sometimes it's TMI, with my patients, they'll come in and I draw out the whole electron transport chain. Oh yeah, I'm like, complex. I was like NAD plus, it grabs the electron and it brings it to, complex 1. And then I talk about complexes 1 and 3 and how when the mitochondria don't work well, like in concussion, they start leaking. So complexes 1 and 3, you get leakage of electrons, and that forms like superoxides and all these other free radicals. And we have to do something about that. And I'm like, you know what? If you don't think that this is the way to go ask your doctor to draw you even the electron transport chain. I bet you they don't know the name of one they don't know anything that's on that complex because they don't care. The last time they looked at it was back when they were in med school, and they thought it was just cool because you can wear a T-shirt that says "Mighty Mitochondria." I work out, but you don't know anything of the powerhouse of the cell. All this cool stuff, but it's way more than that. It's literally life. Right, because it has to spin the rotor, ATP synthase. That's the whole thing. That's it. I told my patient, that's it. You got this? And they're like, I don't know what you said, but it sounds cool.
Right,
let's get it going.
Convincing.
Complex 4 sounds good. Let's get the photobiomodulation going. Let's go. So tell me, if people come to you, you're treating everything from A to Z? Like systemically. So do you do a lot of like autoimmune disorders, things like that with these types of cell lines?
And another restriction that's placed on us is that we can't say we treat any diseases, right? Unless it's FDA approved.
Okay, you're thinking, let me rephrase that. What diseases are you thinking of?
Patients happen to have all these problems. We treat the patient. We elevate the energy of the person. We give them a blast of signals. So all of a sudden their cells now know what to do and how to repair. So they're awakened. That's really what we're doing. And so what are we seeing in the clinic? And this is why medicine has become, so much more fun, is because, I'm not even trained. I'm not an orthopedic surgeon, right? I'm not a liver specialist. I'm not a heart, cardiologist, but I'm able to make 100%. Improvements in all these conditions all throughout the body more than the specialists can. And that's what's really fun. So literally we treated from head to toe, everything you can think of. The TBI, actually started a clinical study on TBI and traumatic brain injury. And then incredible results in Parkinson's. We've seen really good results, Alzheimer's and even ALS.
I mean, if you look at the Parkinson's model for light therapy, there's actually a Parkinson's model in the primate. It's a dramatic reduction in their tremor. Actually, they did some of that work, at Harvard. Dr. Casano, that we correspond with. He's a great guy, by the way. He's the head of the light therapy, lab at Harvard. He voiced tremendous frustration in the fact that these things are not being used. We have patients, and we have people that we're thinking about treating with stuff that happen to have a disease called Alzheimer's that we've treated with transcranial laser therapy that remember their family's names for the first time in 2 years.
Wow.
And again, what's the harm of doing that? Nothing. So, people are out there like, that doesn't do anything. Where's the study? All this. I'm like, you guys are not getting it. This isn't like we're drilling burr holes in somebody's head and putting in, wires or doing something like transnasally. I mean, we're putting light on somebody's head. The treatments are 10 minutes long, and you're getting these amazing, these amazing results. But there's this, this tremendous, pushback. All right, what's your vision for the future? For you, what are you trying to do? I know you're trying to do big things. I'm going to have you back for another part 2. Of this episode. I might have to go back to doing my long 2.5 hour, podcast, unfortunately.
This is too much fun.
This is fantastic. But what's your vision, of the future?
I really feel like we have a chance together. We have a chance at transforming human health landscape. We literally can change the fabric of what health and longevity is. So even with just stem cells, not to mention all these other tools that we're both using, peptides and different supplements, light energy, even just stem cells. On animal studies, it shows consistently regular IV stem cells of younger cells to the animals allows animals to live 30% longer. So I want to give this to people, right? If you have the foresight and the openness to utilize this, I can help you hopefully live another 20 years that you wouldn't have, and another 20 healthy years, not just hanging on years.
Not sitting in a nursing home staring at the brick wall.
Because in animals, what they showed, if they give animals regular stem cells, these animals, not only they're living longer, but their fur's shinier, their locomotion is better, their cognition is better. I mean, literally look.
That's one thing. Mix that with light therapy treatments and specific regenerative peptides.
Mm-hmm.
Now you're just dramatically slowing down.
Yeah, all I care
process.
about. Yeah, so people say, "Oh, you're doing all these things. You don't know what's." I don't care. I don't care that I don't know what's doing what, because the body is a soup of complexities. It's a little universe. You can't control everything. You know what they can do. And there's a system, there's elevation. When you put a lot of things together, there's an elevation.
There's a synergy between, it's unbelievable.
Property. Yeah, same like herbs. If you just give somebody one herb, it can do maybe one thing. But if you give them 5 herbs together, now you may be creating some magic that you would never see with one herb. So that's what I want to give people.
But the thing about it is, at the end of the day, the safety everything we've talked about right now, the safety profile is so amazing. I don't know how many patients you've treated, but when I had Neil Riordan on the thing at the Panama Stem Cell Institute, 30,000 patients without a single horrible adverse event. In 30,000 patients, 30,000, not 3,000, 30,000, but it's very dangerous. It's obviously it's very, very dangerous, because if you treat 30,000 patients with Tylenol, people should look and see what happens with that. So in fact, there was a study, 80,000 people, I don't remember the exact number, about 80,000 people, they looked at 80,000 people that had done ozone therapy in Europe, had a better side effect profile than acetaminophen. Better.
Yeah.
And this is what we're worried about, because I know recently I was talking about ozone, and somebody was like, "Oh, the safety. What about all the dangers and the harm?" I was like, "Show me one paper show me one case report in 20 years on EBU therapy and a horrible. Show me one." I was like, "Please." There's a lot
of scare tactics.
They're like, "Well, the absence of those reports is not that." But I'm like, "But you're flipping it around." But you're like, "But tens of thousands of people have been treated with this stuff with great results." Not everybody's going to. Some people don't get any. Not everybody gets results, but most people feel much better with EBU ozone therapy.
Yeah.
But yet, they just want it both ways. They just switch the argument, whatever they want.
The thing is, people trust medical doctors. And medical doctors, I remember this female doctor, and it made me kind of blood boil, because she was saying ozone therapy is very dangerous. So she started to say, she said, "I don't know enough a lot about it, but from what I know is very dangerous." Well,
read the Madrid Declaration of 37 countries and go look at the study of 80,000 people, and then you'll know.
Yeah. And it's the arrogance.
It's bizarre.
Yeah.
So what for you though personally, what's next as we wrap up, and then I want you to tell everybody where they can find you and all the good stuff. It's always sad at the end to kind of wrap up when we're having a great time. But so for you, are you expanding nationally? What do you want to do?
So that came together with a vision. What I want to do is to make this more available for more people, right? If I can give this to more people, then we can actually lengthen the lifespan, of a population in general. And I always give the example of an old doctor, 80-year-old doctor, who's still seeing patients and who's loved by the community, but the time is coming near, right? But what if I can give that doctor 20 extra years, and he can have all his wisdom,
I'll take the 20 extra.
Exceptional skills, and continue to give, right? And spend time with family. I mean, what a difference is going to make to our world. So that's what I want to do. So I'm looking at national models to deliver stem cells to more people, make it more easily accessible, more affordable. So that's that's one of the things that I want to work on. Of course, I have my a cream or a cosmetic line, Tower Omni. So
which I'm going to be beautifying myself with, just for you guys.
Yeah. So no, you get
gonna
this
do it.
incredible nourishment and glow. And of course, over time, there's, people have seen like discolorations reducing, and of course, fine wrinkles going away. Yeah.
But again, mixing those things with photobiomodulation
Absolutely.
and other things, and also
Absolutely.
obviously watching your
so
diet.
I want
and
to
things like
I
that
want
is-
to do more on the cosmetic line, but really make this healing modality more available. And of course, I continue to educate doctors. I have an academy.
Thank you for doing that. Just you know what? Sometimes I don't know if you use expletives in your in your talks at all, but I can tell you, when you come to our Sovereign Provider Mastermind, my opening, which I already have already.
Yeah.
There's a lot of words that
I
there's some
love
choice.
them. I love
There's
those
some
words.
choice words because I'm like, wake up. Like, just wake up. I'm not going to use the words right now, but just they need to wake up.
Sometimes you need to use the words, to really express the gravity of the situation.
It is. It's for our healthcare provider colleagues. It's catastrophic. They're sick. Basically, they don't accrue wealth because they're so busy being busy, they forget to make money too. And again, I know the general population, I know you guys don't care about that, but trust me, a lot of doctors retire just like athletes, completely broke. These are real statistics. And then obviously they have no time. So learning how to manage their time and
Right.
compressing it, because when they're all scattered and you're not managing your time well, you're not a good doctor. I'll be
Yeah.
honest, like you're going to be snippy. You don't want to really see patients.
I'm really
People annoy
teaching
you.
doctors to have a way of being free. Like you can be free, and you can. I have a saying: make medicine fun again.
I love it.
This
Let's
is your
get,
chance.
let's get the hats
to
going.
make
No
medicine
political
fun
affiliation.
again,
Just
because
relax.
it doesn't have to be so miserable. Because medicine has, as a profession, has become miserable. That's why so many doctors are quitting, and they're making like this one doctor, OBGYN, she said she was losing money every time she does surgery, so she has to supplement her income with cosmetic.
This is exactly what we're teaching at our courses. We're going to teach them how to get their lives back, get them off the hamster wheel, and they're actually going to become better doctors and nurse practitioners and dentists and whatever, in chiros and whatever they do than they were before, because now they're going to be focused. They're going to be actually putting money away for their families and their legacy, and we're going to get their health, in control and make them believers in these other things. Because when they try it themselves, all of a sudden it's magic.
Yeah.
Oh my God, I feel amazing. Well, really, we've bin telling you this for a long time.
The anti-aging
Doctor.
doctors are, these
Yeah.
American Academy of Anti-Aging Medicine. I always ask people, why did you become an anti-aging doctor? How did you come into the field? And I think a third of them are kind of open-minded like me. Like I'm just like open. I'm ready to use new modalities. But the other third is that they have gone through personal health challenges. And the other third is that their families have gone through something really bad. And they've tried everything traditional medicine has to offer. And then they come to an impasse. And then they try something that's alternative. All of a sudden, life turn around.
Alternative.
Yeah. So
It
wake
should be
up.
mainstream.
Yeah.
Alternative is
Maybe
actually mainstream.
instead of waiting until you get sick or your family
Yeah.
gets sick, and just open up your mind and see what's
Well,
out
that's
there.
what we're gonna teach them, how to open up their mind, and if they don't leave the room, because after my expletive stuff, then I say, you know what? If you feel like this is not the kind of like language you want, because I was like, I got to wake you guys up. Like I can't, like this can't be like a very buttoned up conversation because you're too far gone. We're way past, like it's when your kid misbehaves.
I hope it works. Does it work?
It works. It definitely works. I was like, because if like when your kid misbehaves, at some point you're just going to explode. Like you can't tolerate it anymore. So then the discipline has to happen. So we're gonna have to discipline them a little bit, but they're gonna not regret coming to these things. They're gonna learn, a ton of stuff.
It's really fun to be at the forefront of this new way of doing medicine and just waking people up. I mean, it's only the right thing to do because this is the right direction in history.
I love it. We want to be on the right side of history. How can people find you?
There are quite a few avenues. So one is my website, joycongmd.com. So it has everything I'm doing, the stem cell company, my clinic, my memoir, Tiger of Beijing, my cream, and then the Academy, American Academy of Integrative Cell Therapy. And then they can also watch my YouTube video. So that's free education on stem cells. It's just Joy Kong MD. I have so many videos. And then my podcast, the Dr. Joy Kong podcast, they can find it anywhere where podcasts are. So my clinic is in Los Angeles, here in LA, called Chara Health. So yeah, and Instagram, I do respond to people's comments. I like engaging and helping them. So it's at Dr._Joy_Kong. So you're welcome to follow me.
And you'll see my comments on her Instagram page as well.
Yeah.
I've commented on there. And definitely watch those YouTube videos. They're very educated. I've watched a bunch of your YouTube videos. Very clear, very very much to the point, and everyone can. It's good for for professionals that don't like really know what's going on, but it's great for the lay.
Yeah.
People that just want to learn.
I actually tell people that if you watch all my videos on stem cell therapy, you will know 99%, more than 99% of the doctors.
You will 100%, will, because they're pretty like, no, that doesn't work. That's horrible. Like I used to be, before in my ignorant phase. So, listen, this has been amazing. I definitely need to have you back. And I look forward to I'd love to have you on the stage at our events, teaching some of this stuff. I think it'd be amazing. And
I'd love to help more doctors. Yes.
Yeah. Let's help. Let's help everyone. Let's help as many as we can. Thanks everyone for being on another episode of Wellness at the Speed of Light with Dr. Joy Kong. This has been amazing. Watch it again if you didn't get enough the first time. We'll see you on the next one. Thank you.
Thank you.